back. Cross-body indirect myofascial release. Place hands on the body across from you and just hang out. Let hands become one with the back. Usually this is going to last for 3 to 5 minutes. And this is what we do with pretty much all of our indirect myofascial releases, is we hang out for 3 to 5 minutes. Hands can switch. You can move up or down the back. It's totally up to you. Again, you're going to hang out for 3 to 5 minutes. And now we do cross arm, and in this case we are doing it to the opposite side that we are standing on. And again, usually you're going to hang on to this for 3 to 5 minutes. And once we've done the opposite side, we can do the same side that we're standing on, and again we hang out for 3 to 5 minutes. And this is the indirect method. Here we're over the spinous processes and the sacrum, and this will allow for the potential for a release of the sacrum. But your intention is a little bit of movement inferior with the bottom hand and a little bit of movement superior with the top hand. Now we'll do the release of the sacrum. Again, we want to hang out for 3 to 5 minutes. And we can also do some simple oscillations. Again, reinforce sacral release. This time there's a little bit more pressure put on the sacrum and a little bit more pressure for the top hand to move towards the occiput. Skin rolling, a basic technique. You can assess tissue with this technique, and this is a great fascial release. Just picking up between your fingers and your thumbs. You can also S-bow and C-bow, use those techniques on the back. And then you can do the world famous shake and bake, where you move the skin between your fingers. You can move medially towards the spine, laterally away from the spine, and you can also move inferior and superior as well too. And you can do that throughout the back. So now we're going to do some direct myofascial release on the erector spinae, and this is where the therapist, as you can see, is doing the action themselves, and we are now using the meaty part of the forearm. That means the palms are face down. Again, check in with your client, make sure they are comfortable with the pressure that you're using. Now we'll use the ulnar border, and all you need to do is just basically turn the hand up so the wrist and forearm is in a neutral position and the thumb is facing up. Again, check in with your client with regards to pressure and comfort level. Now we're going to use the elbow. Again, check in with your client for comfort level and take your time moving up. And just be careful when you get up closer to the scapula. Things get really sensitive there. So now we're going to do direct myofascial release. We're going to do some knuckle stripping of the erector spinae from the occiput to the sacrum. And basically with this technique is we're putting our fingers on either side of the spinous processes. We can start at the occiput or we can start at the level of C7T1 and work our way down to the sacrum. And as you can see, it's reinforced as well too. And specifically, if we want, we can start right at the occiput and just go down to the level of C7, T1, maybe T2, specific to the suboccipitals. So now we're going to do a direct dynamic release where both the therapist and the client work dynamically. So the therapist is moving their knuckles down the neck and the client actively tucks their chin or dynamically tucks their chin. And now we're going to do a direct myofascial release of the Quadratus lumborum. And basically what we're doing is to look for the iliac crest and the 12th rib and in between. And we're just going to get our fingers to get in there, and we're just going to lean back and pull. You can also ask your client to breathe in, and when they breathe in you should feel Quadratus lumborum against your fingers, and when they breathe out then you can let yourself just lean back and give that muscle a good stretch. Breathing in and out. So we're going to do a direct dynamic release of the Quadratus lumborum. Client will actively reach ahead with their arm while the therapist pulls back with their fingers. And there we go. This will add more of a drag, more of a pull on the muscle. It'll also give us a little bit more of a stretch. And next we do latissimus dorsi, and we do a little bit of a test, see if we can feel the fibers down towards their distal attachment. Hand maybe over the thoracolumbar fascia. Again, testing again to find the bulk of the muscle belly. And we're going to do an active or dynamic drag of the latissimus dorsi, just like the QL. And just going to lean back. Now we're going to drag So we're going to pull and we're going to lock it, so keep it in place with dynamic movement. From the client, again, they're going to reach forward. Because we are so close to its proximal attachment, we're going to restrict the movement just a little. Yeah, and we'll do the same movement again, except this time we're going to be locking a little lower, and then we are going to work our way up as previously shown. So here we are, starting lower, we're locking in, the arm gets pretty far forward, move up a little bit more, again same idea, locking in, and we'll lock in again. And as you can see, the range of motion is a little less each time. So now what we're doing is we're going to look to see if we can isolate the attachment of the levator scapulae on the scapula. And just swinging the shoulder blade, lock in levator scapulae, and then we're going to ask for movement from the client. And they're going to do cervical contralateral rotation. In other words, they're going to turn away from the side of where you've locked in.